Good morning and welcome to another edition of the Greenbridge Community Housing Podcast Luton. We're joined today by Lawrence Kay, the CEO of Active Luton.
Yeah, morning, and thank you for inviting me down.
It's lovely to have you back. We did do one before. Abdul was not happy. No, we have to make it real. Abdul was not happy with the way it was filmed, so we're back again. So thank you.
That wasn't my fault.
No, it was nothing to do with you. But it's lovely that you've taken the time to come back and talk to us, so thank you. Tell us a little bit about why you joined Active Luton.
Yeah, Active Luton. So I've been working now, it's actually, this month is 30 years in the industry.
Goes so quick, doesn't it?
It has gone quick. So I've worked in sports development, facility management, and then as sort of the industry grew and moved more into wellbeing, more holistic wellbeing. And I saw the opportunity as CEO at Active Luton, but I'd met Helen, who was the previous CEO, probably about before COVID. And been quite inspired by the work that was going on. Quite unique for what was termed as a leisure trust, now a wellbeing charity. So I followed Active Luton probably for about 6 or 7 years before I joined. I've been here about 2 years now. Just because of the success it was having and engaging and impacting the community. So I even came up a couple of times to meet Helen and the team, to benchmark against the work I was doing at the time. So I was working in a similar organisation, but an organisation that probably didn't have the community partnerships as well as established as Active Luton. And then the opportunity came up and I thought, I'll give it a go. And fortunately, the board were happy with my presentation and my interviews, and I was interviewed by a lot of partner groups as well as the team, the director team. It was quite intense.
I can imagine.
But fortunately, they felt I was the right candidate, and so I came into the role and tried to continue the good work that Helen had put in place. We're 21 years old this year. So, we're well established.
Very well. I'm 26 years now with the company.
Yeah, that's impressive. And what I've found is we've got a lot of loyalty.
Yes.
I'm very fortunate. I'm in a position that I give out long service awards.
I haven't got one.
Well, I'll look into that.
Please do.
I'll look into that because we've introduced a couple more actually since I've started. So we've now got 5, 10, I think it's 15, 25 and 35 years.
Well, I'm well behind then, aren't I, with all this?
What's going on? I'll look into it. Because obviously our company being 21 years old, but people will have transferred in from different services. And that's why the length of time can be longer. But yeah, I've been privileged to be able to hand out a lot of awards since I've been here, and it shows the loyalty that people have got to Active Luton, and hopefully the belief in our purpose, which is around supporting the community. And I don't think people would have stayed if they felt that had changed. So yeah, what attracted me was the work that had been done and the opportunity to continue and hopefully expand on that work. Because there is, we have to be honest, to look at the stats. I looked at a lot of research when I first came and still do. And unfortunately, the health outcomes aren't where we would like them to be.
No.
And Luton does have its challenges. There is deprivation, and we know there's poverty. We aspire and work to the Luton 2040 vision, which is to eradicate poverty.
Do you think that's possible?
I think it's possible. I think it's aspirational. Obviously, it's 2040 vision, which is, what are we now? 14 years away.
Yeah.
But when you read the impact reports, progress has been made because multiple partners are now involved. This is not the council say, let's do this. I think truly it is a partnership and collaboration with multiple partners with the same goal, which is eradicate poverty, but how do you play your role in doing that? And ours is around supporting that holistic wellbeing aspect, which we know if people feel happier, they're more likely to be able to get employment and they're more likely to live longer. And that helps to pull people out of poverty and helps to stop people going into poverty. So we know that we play our role. Will it be achieved by 2040? I hope so.
If not before.
If not before. And I think, as I went to a conference, the Luton 2040 conference recently, and that was quite inspiring. You could see that the work that was being done and that people are getting behind a vision, which, to be fair, again, I've worked for 30 years, I haven't seen a collaboration like that anywhere else I've worked. You see pockets of really good work and where partners, try and get behind objectives, but this is quite clear that, that room was full. Hundreds and hundreds of people committed to the same goal. So, yeah, I think it is achievable, but it won't come without its challenges.
What will the challenges be?
Well, a lot of the challenges will be funding, will be support, will be keeping the focus, when obviously we all have other priorities within our organisations. We all have our own challenges. But I think the fact that it's quite clear what the vision is and they're collectively it's articulated how we play that role, I think we can keep on track, but every organisation will face challenges. Obviously, I'm not political. My political knowledge isn't great. But local government is changing.
Massively.
And other changes could come afoot in the future. You never know about devolution. We don't know where we're going to be. That could play a part in either accelerating it or causing some more challenge. But hopefully the Luton 2040 vision will live on whatever the local government structure looks like. So yeah, there's always going to be multiple challenges. And when you've got so many partners involved, there will be some conflicting priorities at different times. But I think it's clear from what I've seen that people still have that as a forefront of their own corporate strategies. So I'm still hopeful.
Lots of talk in the media about the stats for the health and obesity and lots of other diseases, etc. in Luton. Why do you think it's so far down? Why do you think we're so far down the list?
I think it's difficult to say, really. It's going to be historic. I mean, obviously, the hat factory, the hat industry. My knowledge isn't brilliant, but that was a huge industry, which obviously would have declined. That would have caused issues, as with many towns and cities where they not necessarily rely on one industry, but quite reliant on an industry. When that industry declines, it can cause social issues that come with that, where unemployment comes in. Now, clearly, fortunately for Luton, obviously Vauxhall's was there. That's also now gone, which is a big issue.
Yeah,
big issue. Completely on the positive, though, there is just a lot of development and a lot of inward investment, with the airport being a huge part of that. Yeah. Obviously, we're on the boundary of the Universal Studios, which will create job opportunities. But why have we got these issues? I think it's just that part of it is history, and we're overcoming history. And I think it's perhaps we haven't worked as collectively as we could have done in the past to try and find the solutions. But Active Luton and many of the partners we work are recognising, have recognised for a number of years, there's the link between deprivation and poor health outcomes, and therefore are trying to target the work we do to the people who really need our support. I know we're working very closely with the council now, who have identified what they term as the top 20,000, I think it's income deprived. And how can we get those people into employment? If you get people into employment, it helps drive them out of poverty. So there's, I really am quite encouraged from what I've seen in the 2 years here, not just from the partners, but from our local authority as well, that have really tried to get hold of the issue. And we're working very closely with their transformation team, looking at how do we target resources to those areas that really need it more than others. When I look at those stats and look at the work that we do against some of those areas, we are in there. We're doing a lot already, but we can always do more. And yes, you can look at stats all day long, but I think we are trying to use stats to help drive our work, because as we highlighted, there is poor health outcomes, unfortunately. But we're starting to see some inroads in that and some improvement. But I think, again, it goes back to that collective vision. If we can all understand that collectively and we all play a small role, that becomes bigger. And I think we can improve the health.
How does the general public, somebody maybe on low income or who hasn't really engaged in physical activity, get involved with what services Active Luton have to offer?
Yeah, there's multiple ways of doing that. So, first of all, you want people to understand what their situation is and want to be ready to change. And we do quite a lot of awareness campaigns and support, as do other partners, around, well, actually the benefits of being more physically active.
What are those benefits?
Well, I mean, there's strong links between improved physical activity and mental well-being, social well-being, even financial well-being. We go back to what I said earlier. The research is telling you, if you're more physically active, your mental health tends to improve. Mental health improves. Actually, there's good links to more employment opportunity, because you're more in the right place to address those other issues that you may have. So it's quite complex, because physical activity is not going to solve everything, but it plays its part in trying to support people. How we do that is through multiple different ways. We have a commission service, so Total Wellbeing Luton. It's quite targeted, so that involves things around stop smoking, social prescription, weight management, and supporting people with long-term health conditions. And there's multiple access and pathways into that. That's not just from being referred by a health professional, but there is also self-referral ways into that.
Okay, so you can self-refer yourself, yeah.
And we don't just wait. We go out and work in communities. We're at multiple events trying to raise awareness of the opportunities that are out there. And those opportunities are largely free or heavily subsidised through the funding that we get through the Integrated Care Board and Luton Council's public health team. So we're a very fortunate position that we have these clear referral routes into not just our facilities, but into other settings as well. What we're trying to do is ensure that where you need us, we are there. And we're very fortunate, because we, on behalf of the council, operate 7 leisure and sports facilities and 5 libraries. So when you look at the spread on a map, I think there's a stat that says you're within about 600, 700 yards of one of our venues. And what we've done, or are still attempting to do, and we're getting there, is that integrating fully the library service into the wellbeing field and stuff. So it's not, the libraries have come so far, the whole library service as a whole has come so far. It's not just about taking books, which is really valuable anyway, but there's other opportunities in the library. We have our stop smoking clinics in the libraries. We have wellbeing
within the library setting.
In different library settings, we'll have stop smoking clinics. We'll have the opportunities to come and meet some of our wellbeing teams.
Right.
So there's that side of it. We also currently have the funded contract for holiday activity and food, which is free access in certain holiday periods for children eligible for free school meals. What happens when you've got children eligible for free school meals, in the holiday periods, those opportunities to have a nutritious meal once a day might not be there for some of these families, sadly.
That's right, because they probably would get that in school, right?
They would.
Right.
And so that this funding that comes from the government and is channeled through ourselves, work with 40 different partners across the whole of Luton in the holiday periods, is to deliver, some activity, including physical activity, so for 4 hours a day, plus a free meal.
Wow.
So I think it's over 7,000 children accessed that service last year.
That's
and
amazing.
And again, we link in with multiple partners there. So we work with the food bank as well. We work with our wellbeing team to do cook and eat sessions. So we're trying to not just give a free meal, but educate some of our more vulnerable families about how they can cook on a budget, how they can actually access that food from the food bank if that's the need for them, and we can give them those routes into there. And then through our leisure facilities, we have certain free access, but we also have our Go for Less Advantage cards, which are...
Tell us how that works.
So it's a heavily discounted card, really, and you have to be eligible for that card. And that a lot of that is on eligibility criteria, which effectively supports people who perhaps can't afford some of our mainstream prices.
Okay.
Again, we have thousands of people that are benefiting from that every year. And again, we're very fortunate as well, because we have a relationship with Luton Rising.
Yes.
And we receive a donation from Luton Rising that helps keep our prices low across all our sites. So if you looked at our pricing, our normal pricing, it's very, very competitive across, our health and fitness, our swimming. But even then, we appreciate that not everyone can afford that.
Yeah.
So then we have our Go for Less advantage as well. And that is subsidised and supported by Luton Rising.
And that gives you access to
the facilities,
the whole facility.
Lots of different elements of our facilities and programs.
Right.
The information's all on that website. We can speak to anyone. Can call us up as well.
Okay.
Look on our website, call our contact centres, and speak to our team, and they can go through the exact way. One, what the benefits are, and how to access that card.
And what's the website?
So it's www.activeluton.co.uk.
Perfect. So they can actually go onto the website, log on, have a look at what's available. If they're not quite sure, they can give someone a call.
Yeah, or call into one of the sites as well.
Just pop in.
Yeah.
You said 7.
Yeah. You're going to test me now. So,
I am going to test you because I only work at 5, so I'd like to know where the other 2 are.
Here we go. Inspire Sports Village.
Yeah. That's in Stopsley.
Yes. Lee Manor Recreation Centre.
Marsh Farm.
Now, Lucy technically is 2 because it's the sports park and the swimming pool.
Yeah, okay. Oh, right, that's where it is. Okay.
Hightown Gym and Wellbeing Centre, which we rebranded last year in September.
Which is where I train, and I can vouch, not here to sell it, but it is a fantastic facility.
Thank you. Stockwood Park Golf Centre. Stockwood Park Performance Gym and Athletic Centre. So that's 7.
Golf.
But what we've also got, which you could argue is a facility, is in September last year, we introduced what we call the Wellbeing Hub, which is in, I keep getting the name wrong, is it the Fraser Shopping Centre now?
Yeah, it is the Fraser.
It's changed a few.
Fraser
it's
Point.
Changed. Has it changed today?
Fraser Point.
Yes. So we have what we class as a Wellbeing Hub facility.
Yes, I've been.
It's outside Poundland, right in the heart of the shopping centre, and it provides an opportunity to come and speak to our wellbeing team. If you're looking for stop smoking advice, weight management, social prescription, or just general, want to talk about your health needs, and we can't help with everything, but we can refer you or send you on with advice as to where to go. We've delivered well over 3,000 blood pressure checks since we opened in September. It's all free of charge, and mini health checks. So whilst it's not a facility as you would see our facilities, we see it as a crucial addition to the portfolio right in the centre of Luton, where again some of the health stats are an issue, and it is providing a really good service. So
it is, and I think also, Lawrence, if you're not able to get an appointment with the GP or it's taking a long time, you can just anyone can pop along.
Yeah,
I even had my blood pressure. Praise God, it was okay.
Excellent. I mean, obviously, we can give you the mini health check. We can do the blood pressure check. We can't give you advice on everything.
No,
but we can send you on your way to signpost you. But obviously, if it's anything to do with Total Wellbeing Luton, and again, that all the information on the website, that they are things we can easily support you with, which is that list of programmes that I mentioned earlier. And it's manned throughout the opening times, 7 days a week.
And what are those opening times?
So they are the shop opening times, which I believe are 9 till 5:30, and I think it's 9 till 6 on the weekend. Sometimes we have to adjust those, but we are mainly covering those shopping opening hours because
great,
that's
isn't
when
it?
people
Great footfall as well. Constant flow.
For us, it's a constant. It is a constant flow. And because people know it's there, they might have the blood pressure check, and they might be okay, but they can come back in a couple of months because they know they can come and do it. Yeah, and we have that, and we have, unfortunately or fortunately, whichever way you look at it, identified some really high blood pressure. Which is
a good thing.
Yeah, people just don't know.
No,
and so that facility is really playing its part in supporting free access almost on the high street, if you want to call
literally.
it that, which is quite a unique approach that we've introduced. So that's working really well, but hopefully that's outlined and put me on the spot, the 7 sites that we plus the 5 libraries.
Plus the 5 libraries, living on Marsh Farm myself, and the 2040 vision and the pride in place for Luton, plus the £20 million that has been pledged by the government over the next 10 years. How how is Lee Manor, if you like, going to help support the deprivation in the Marsh Farm area? Have you got programs in place? Because I've obviously, having lived on the estate for 40 years, I know the ins and outs of everything that goes on. Very actively involved in the trust, the Woodland Trust, and anything to do with the residents, really. So I'm keen to find out if there are any earmarks or benchmarks or plans to maybe reopen a youth hub, which is really, really essential. I know you've got, is it Giggles, Squiggles?
Yeah, Giggles.
The Giggles, so cute. Fantastic facility for parents and children to access, 7 days a week and obviously during the holiday. But it's really about the young people.
Yeah, well, first of all, there's a lot going that we're involved in Marsh Farm.
Good.
So just to go through it, obviously we've been managing Lee Manor Recreation Centre for quite a number of years, and working with the council, we're looking to extend that contract, so we're here longer.
Good.
We're just in some discussions, and hopefully that will work. Marsh Farm Library, and
use it all the time. My husband's there every day.
Excellent. That's what we like to hear.
Yeah, yeah.
And as you said, we took over what was a closed soft play facility in Futures House.
That's right.
Which was the Futures Fun Factory.
That's it.
And we took it over in November. We shut for a month. And we basically did a bit of a mini makeover. We added new equipment, total paint job everywhere, a new brand, a new name. And so, but what we are, 6 months
6 months on. It's really busy.
Really well. It's going really well. We kept the prices low.
Yeah, which is great.
As we said right from the outside, we would keep our prices low. And actually, it's doing really well. And I think in my old job, we did a lot of work. We had soft play sites. And people go, oh, it's a soft play site, kids go there. Well, they do. But they learn how to interact and socialise. It gives parents an opportunity, a slight rest. Don't get me wrong, I'm a parent. It doesn't give you that much rest, but it gives you a slight rest, and then maybe an opportunity to meet new people. Or your friends. But we also have the Holiday Activity and Food programme going through there now.
Oh, wow.
So again, children who may not be able to experience that,
right,
we have that in place now. We've got a programme over the summer. We had a programme at Christmas. So we are utilising that facility perhaps more than it was before, which is just a good opportunity to again engage new audiences. And we are looking at different ways that we can engage with young families, but that linking that into some of our wellbeing programs that through Total Wellbeing.
Yeah.
We also do stop smoking clinics in Futures House, and we've done other events within Futures House. So we have what I would say quite a presence in Marsh Farm, and we're proud of that. We're proud of that.
Yeah.
Lee Manor itself, we've just relayed the AstroTurf, so that was quite an investment, over £250,000. So there's a new surface literally probably 2 weeks ago has gone down. So a 6 or 7 week job. So that's gone down. We've introduced a new app which will make it easier for people to book on there as well.
Good. It was quite difficult before, wasn't it?
It's just when you don't have an app, people are used to using apps, and it's going to make it a lot easier and less clunky for people to get that opportunity. We are looking at an investment into lighting in the car park. We're just waiting on confirmation on that.
Yeah. The big one up the top.
Yeah. So again,
it can be quite, after you've done a class. I mean, even if you've taught or you're going home, obviously you might have people playing out on the floodlit pitches. But if not, it can be quite unnerving. Yeah,
we've acknowledged that, and we've gone through planning. We've got planning permission.
Good.
We hope to get it in this year. It all depends on timing now with contractors, but it may be next year. But we're committed to doing that.
Good.
And again, that's a hefty investment.
Yeah.
It's amazing how much lights cost, but it's the right thing to do.
Yeah.
And then inside. I can't give you the full detail yet, but we have exciting plans around the health and fitness.
Good. All right.
So we traditionally in gyms and leisure facilities, you look to change your equipment probably on a 5-6 year cycle, and the Lee Manor equipment is due now. I don't know if you've had the opportunity. Well, you've seen Hightown. You use Hightown. We've got Inspire, we've got Hightown, got Lucy as well.
Yes.
We've changed all of those gyms in the last 18 months,
2 years, yeah.
But hopefully what customers are seeing is that we're looking at the needs of those communities and what they want. So you're starting to see what's called more functional equipment in there, more free weights, which is what our younger people want.
Yeah. And the older ones,
the older ones, like myself. I have to. Sadly, I'm in a new tick bracket.
Yeah, I know, right? When you get into it, I'm not quite in that next bracket yet, but it's 6 months away, and I'm like, okay.
So I have to. Yeah. I ignore age, but
so do I.
But we know that people have got different demands these days in health and fitness. So we have big plans for Lee Manor. We're just
That's even better for me.
We are
2.5 minute walk.
Well, there you go. I think if you like Hightown,
I love Hightown.
Then you'll be very impressed with our new plans. I'm hoping that I can talk more about it in about a month's time.
Okay. Cool.
But they're big. They're big, and this isn't just about replacing the kit in the gym. This is about a full. Refurb almost of that area, and ideally an expansion of that area. But I don't want to say too much.
No. But don't spoil the surprise.
But we will spread those plans. So yeah, and then obviously the rest of the site, we're doing a lot of work around the swimming side of things, looking at our programs, trying to increase our Learn to Swim program, which is massively important to get people to learn to swim.
Yes.
Very important skill, and at the same time, you're improving people's physical health. When you talked about young people, we work, Be Active, which is the Active Partnership, are part of Active Luton.
Yes.
And we've been working with Be Active now for about, it's probably over a year.
I've forgotten the girl's name. She did a presentation.
You probably met quite a few people. Graham Simpson is the person who's been leading on this particular project. You'll know the basketball courts?
Yes.
Next to, on the site. And it is run down and it needs development.
But it's used quite heavily.
It is heavily used.
Which is great.
Which is brilliant. And
it is.
So working with Be Active and the council and a number of partners, there was a funding opportunity that came available. And collectively, the right thing to do is go and speak to the community. So over quite a long period of time, we spoke to the community as a whole, so sports clubs, the young people who use that facility.
Yeah.
It's a free facility.
Yeah. Which I think is great.
And a lot of it is around basketball.
Yes.
Which is excellent. And the basketball facilities in Luton could be better. There could be more opportunities. And we want to improve that. But the funding that we were looking at, and actually we really strongly believe that we could attract, would have created a multi-sport space there. Right. So it would have included more sports like football, basketball. And the community said, no, we want basketball. So we're like, okay, we won't go down that route any further. Lots of consultation, that's fine. That's what you've said. So what's happening now is there's another group that's been set up purely to just find funding for basketball to redevelop that court with the premise that the majority, if not all of the time, would still be free access, which it is now. So you ask what we're doing. We're doing so many different things. As I say, we've got the library, still working with the library, work closely with the school. We're doing all the developments I mentioned in the leisure centre. We've taken on what was an underused or not working soft play site, reinvigorated that, which I think will support Futures House, having more people coming through there as well. Yeah. We've got our clinics already in there. We're linking in with community groups. We're trying to improve the basketball facility. And we're out in the community as well. Our Wellbeing team's in that community. Our community team, our education team, work with local schools. So we're trying to do, but we can do more. We can do more. And it is
sound like my boss.
Yeah. Well, no, because
every time I sit in the office, can we do any more? And I'm like, okay.
What's great for us is that the council have identified that as a real priority area, Marsh Farm. It is. And the fact that we're already in there, we work with the council. 2 of those facilities are council facilities. To be fair to them, they are looking at how they can also invest in their own facilities as well.
Good.
So collaborating with the council, numerous partners, we have got a really strong presence. And we just want to expand on that. We want to understand more about what Marsh Farm community wants, and respond to that in any way we can. And this 20 million. It's gonna.
I'm
really
excited.
help. I mean, I know
it's gonna be.
The groups have been set up, haven't they now, or they're being set up to steer it, and it's great because it is community voice. The community is going to get listened to. You know, the decisions are going to come from that community, not someone that pushing buttons. This is what I think should happen. You know, this is a great opportunity for Marsh Farm, and also the money going into Central as well.
Oh yeah, Central Luton and from Central Government. I think it's really about reigniting the town. I was really excited to walk after I finished my training session. I walk then through Hightown back to the car park, and it's really exciting to see how the regeneration is starting to happen in Hightown.
You can see it. Yeah.
You can see it. You can feel it. The festivals that are happening, the Christmas market that happened. The total wellbeing. Obviously, I speak quite closely with Fee and Leanne.
Yeah, talking therapies element.
The talking therapy element. There's always someone waiting to go in for a consultation or whatever. And it's a nice place to now sit, you can have a coffee, go to the gym if you want to before your consultation session. So it's quite nice that is now being reignited and pockets of the town are starting to...
Yeah, one thing that you could help us with, and I don't know when this will actually go out, is that we put in a awards application for Hightown. Hightown Gym and Wellbeing Centre into national awards, UK Active National Awards for the Regional Centre of the Year.
Oh, wow.
And we found out yesterday that we're now at the stage where a survey is going to go out to people who use Hightown. Oh, okay. That survey will go live at some point this week, and it's only live till early July. It's very short. It's just about how you feel about, hopefully positive. Yeah. And we need to get as many people to complete that in a positive way as we can to help our awards application. What we're trying to do, obviously, is we really believe that it's not just about the gym. No. It's about, if you mentioned talking therapies are in there, we have all these different wellbeing services, community choices are based there with adults with additional needs. They're there every day.
Yes, of course, they're there every day, aren't they?
Yeah, we've got St Matthew's School using it. We've got a church using it.
Oh, the church across the road?
I couldn't tell you the name.
Okay.
The church is there using the facility on a Sunday.
Oh, of course, they have prayer there because I train on a Sunday morning and very colourful. Yeah. So very noisy.
The centre is, like you said, it's a hub within the community of Hightown. When we look at our membership database, it's largely Hightown people, which is what we looked at.
Oh, so the people that are actually accessing it are actually residents of Hightown.
And that's we did what we call a latent demand and a feasibility study, and it told us that there is enough people in Hightown, and we want it to be a Hightown facility. And we are finding that that's the case. And one of the ways you can recognise that is that we were nervous about parking.
So was I.
And it's never perfect. Nowhere's perfect. But it hasn't really been a major issue. And that's because people are walking, because people are local.
That's great. Oh, right. Okay, that is so clever. Yeah.
That's brilliant.
It is.
That's brilliant. We've got a centre that's got all these different aspects to it that are very community-minded and very Hightown focused. We welcome anyone to come, by the way, particularly talking therapies. They're a service right across the town, but they're based there. That's their home. Yeah. And that's part of that integrated service with the service I mentioned earlier, wrapped around into Total Wellbeing Luton. Again, a brilliant service. Supporting people's mental health and linking directly into our programmes. So where it's relevant, they can be referred into some of our wellness programmes that I mentioned earlier, and vice versa. If we feel people will benefit from talking therapies, we can send them through to talking therapies. It's been a real example of where services have integrated and seamlessly moved people around without the client realising, the patient realising that there is two services coming together to work collaboratively together. So it's brilliant. But going back to it, if you could help, push people to complete those applications. The surveys. It is very short. It's very simple. Okay. It would really help. And if we can put Hightown on the national map, and if this helps, this is national. I mean, we're talking huge organisations enter this. Yeah. The winner of our region for the last 2 years was Flitwick Leisure Centre. So we want to put Hightown.
Of course, yes. Although it is nice there.
It is
but
nice. Oh, no, not.
I went there the other day and I was just like, this is lovely. However, yes, it is about supporting initiatives that are happening in Luton.
Yes.
We're passionate about that. I've got to speak to Kai. I think he's one of your
Wellbeing
advisors. He's talking about the effect and the impact on exercise and physical activity and mental health with homelessness.
Right.
As you know, we house homeless people. Literally just managed to get back to him today. It's a little bit behind, but because just like the workload. But I'm really keen to explore how we can support our service users through physical activity, through the Wellbeing Centre, accessing any hubs like most of them are in town, so they walk in through that throughput with the get your blood pressure checked, try and quit smoking, look at your physical and mental health as well. So I'm keen to speak to him about that. So we're going to explore that a little bit further, hopefully over the next couple of weeks. And it is really about collaboration and partnerships. And I'm keen to make sure that our service users do access. A lot of them are in Hightown. A lot of them are in the town centre. And to have that go for less card enables them to then take control of their physical and mental well-being.
Kai's been with us for a number of years, very experienced, so I'm no doubt he'll be able to support you. Yeah,
he actually approached me, which is great.
And that's an example of where we don't just stand still.
No.
We identify what the problems are, and sadly, homelessness is an issue. But what can we do? Where can we play our part in that? I think that'll be a good conversation.
I'm looking forward to it.
Find a way to work together.
Yeah, definitely. What's the rest of it's only 6 months left now, I can't believe it. What's the rest of 2026 looking like for Active Luton?
Well, we had a very, very busy 25, 26.
Yes.
We brought on lots of new projects. So we took on the Giggles, which was a big project for us. We've done a lot of work at the golf centre.
I've not been there. I need to go.
Driving range. We upgraded Lucy Sports Park with the gym and extended the gym. We introduced Hightown with its new gym.
I was so fortunate to be at that launch day. That was really, and how James managed to.
Oh yeah, jump on the box. Yeah, Councillor Taylor, that was impressive.
That was
impressive, to be fair.
That was crazy.
Yeah, it was. So first of all, we need to make these things work. So, and we're confident we can. We've got our big plans for Lee Manor. That's the big one for this year.
Right. Looking forward to that.
We know that it's needed, the facility. We know it's needed in the community. So, yeah, that's a really big focus for us.
Okay.
And then, there's so much work going on across all our teams. And one of the things that I have realised since I've been here is that, I wouldn't say the word complex, but we have lots of different teams. You may not realise we have our active education team that work across schools, in primary schools, with secondary schools as well, providing high quality PE and sport advice and guidance. A lot of people don't know that, but it's been around for years. And we run the library service. Again, people don't know, one, necessarily that we run the library service, but two, what's happening in the libraries these days.
What is happening,
and how we integrate the libraries with the rest of our organisation, and how we're spreading wellness into the libraries as such. So what I've found is that people know pockets of what we do, and I want to spend the next 6-12 months really getting the message out, which is great that you've invited me down, get the message out that, people say to me, oh, you're Inspire, aren't you? No, Inspire
That's what they all think it is.
Is brilliant.
Oh, it is.
What a great asset to the town and to the region for the diving and the swimming.
Swimming, yeah.
But Active Luton is so much more than that.
Yeah.
And there's parts of our organisation that perhaps people don't know as well as they could do, and I think it's just probably don't shout about it enough. About the good work that we do and the success stories that we have, not to show off, but just to highlight, because it then generates the conversation.
Of course.
So, the Kai conversation, well, actually, homelessness is, what could we do to that? What we want is also people coming to us.
Of course.
We've got this issue. Do you think you can help? Well, we can't help with everything.
No.
But the more people understand how we work and the things that we operate, I think people will start to see other opportunities to work with us, and that would be brilliant. Because we know that there's issues and challenges across Luton. The more we can help people, the better. But my a bit of a PR job, if I'm honest, is get out there and get people to understand what we do and the impact of the work that we do.
I was going to say, and it's really important, isn't it, that because people like to know results, don't they? They're like, I don't like surveys, but I will take the survey.
Thank you.
But people like to know, how can it help me? What can it do for me? And more importantly, how much is it going to cost?
Yeah.
And I have to say that I am still shocked at the cost of membership for Hightown, for what you get for your money. I'm still in shock. Every month I check my statement just to make sure it hasn't gone up, hasn't increased, hasn't changed. And I'm not plugging Hightown. I'm just using that as an example of the affordability, that it is affordable. And it won't be for everybody, which is great. We discussed the Go for Less card, but there are other opportunities to use other facilities and still make a meaningful impact on your mental and physical health.
Yeah. As I said before, we're committed to keeping our prices as low as we can. We have to be a sustainable organisation.
Of course, yeah.
We are a charity. We are a not-for-profit, but we are fundamentally we're a business that has to survive. However, I'm quite comfortable to say I believe our prices are, the way I look at it, is low cost, high value.
Yeah.
And when we did Hightown, we knew that spec was going to be high. We knew we were going to produce something really spectacular, and it wasn't just. We didn't just invest in changing a room into a gym. No. We're trying to create a community there, but we also looked at the changing rooms, did work in the changing rooms. We introduced or improved our studio because it all forms part of a package. But we also identified we didn't want to price people out. No. And you just said you want us to put the prices up. No, we won't. But no, I thank you for that, because it is an endorsement that you're seeing the quality that you're getting. And hopefully it's not just about kit. It's not just about how it looks. It's about how it feels and how you feel using it. And how hopefully we're starting to build a community. It
definitely is a community there, definitely.
Yeah. There's no point. I talk about this a lot in the day job with the teams, that we're doing the right thing. We're investing in facilities, we're improving our branding, we put really great kit in. But if we don't support our community, our customers who are coming through the door, and create an atmosphere that they want to be there and want to stay, and they can see that they can improve and get what they want to achieve, because everyone's wellbeing journey is different. Of
course.
Some people might want strength, people might want to just feel better.
Yeah. Sorry to butt in, but the massage guns.
Thermal guns.
Oh my God, what a great idea.
No, that's again.
That was just, so you could just literally at the end of your workout have a massage.
And the idea of that is to evolve from just that, almost what people see as health and fitness, to well-being. Yeah. Because there's a lot around rehab and prehab, and using those massage guns help people with little injuries.
Yeah, definitely.
So again, hopefully you can see it, that we're evolving what we're providing. Again, that is equipment. Yeah. But you're using it, you're telling people, or people will come. I know from the way that you are with me that you'll be talking to those people. You're creating a community, and a facility doesn't work if you just have good equipment and no lights. Yeah,
and we have to give a shout out to the staff too. And
that is the biggest part of it. And I guess that's what I'm getting at.
On it, they are. They see something, or they see someone, maybe not lifting something the right way, or not using the equipment in the right way. They'll gently walk over, are you okay? And they won't say, oh, you're not doing. They'll gently walk over, are you okay with that? Can I show you a different way to use it? Not saying you're doing it wrong. It's great that you've got the boards up there that show you what the equipment does, what area it's supposed to work, and how you're supposed to use it. But if you're unsure, there's always someone
that's brilliant
in that gym walking around making sure, and it's so clean. It is spotless.
Excellent.
So our shout out to the cleaner as well, who I love her. Shout out to the cleaner as well, because it is spotless. And the fact that you can train, have a massage, have a lovely shower and go to work, it's incredible.
No, that's great. I mean, we've just done our annual employee survey. Two of the highest scores that came back were that our teams understand the purpose of Active Luton, which is about community, and understand that we have an impact on our community. And for me, as CEO, to see that I think they were the 2 highest answered questions gives me a lot of joy in a way, because I know that they're going into it, they understand why and what we're trying to achieve, and they want to play a part of that. And I think from what you've just described, that we're using Hightown as an example, and I like to think that's across the board, that because they understand that we're here for the community, they understand the purpose of their role. So their role might be to clean, but they're not just cleaner, they're cleaning to make an environment that people want to then come and train and they become physically and mentally improve their well-being. That's because the cleaners clean the floor. And I'm liking, and I'm working really hard on this to make people realise that how valuable their contributions are. But I think coming through that survey is that people are realising how valuable they are. And how they understand what Active Luton's about. And I think you're seeing the benefit of that, which is really positive.
Done a whole plug for you with
no
incentive. It's been such a pleasure to talk to you again. I'm so excited about Lee Manor. I can't even tell you how excited I am. But keep doing what you're doing.
Thank you.
Because it's working. And I think once people start to feel first of all see, then feel the benefits of physical and mental wellness, it really hopefully will turn that table where Luton's right at the bottom to where we're somewhere in the middle or at the top. Yeah,
we'll continue to play our part in that Luton 2040 vision, like I said earlier. And like you said, I sound like your boss, but we can do more. We can do more, but we also
hopefully Abdul will cut that bit out, because I can't do any more.
No, you can't do any more because you're doing so much, but we can probably do more. And but we just need to keep listening and keep talking to people to understand what more looks like. But no, I just want to thank you for giving me the opportunity to come in.
Don't forget to invite me to the launch of Lee Manor.
Of course.
And don't forget about the 5 certificates that I'm owed as well.
I will get onto that.
26 years service.
Straight away. I'll find out what's going on there.
It's been an absolute pleasure. Thank you.
Thanks very much.